Men have been walking around with these prostates our whole lives. As we age, they will grow and enlarge to the point that most of us will end up symptomatic and with issues related from this process. But what is the prostate? Why do we have it? And how does it cause issues? The fact that only men have prostates is a big giveaway that it's part of our reproductive system. The prostate's role is to make components of semen which help the sperm function correctly and eventually reach the egg. Prostatic secretions contain a variety of substances, including zinc, citric acid, and highly refined sugars, as well as enzymes such as PSA, which you may have heard of, and PSA helps make the semen thinner, but is also a very good marker that we use in blood tests to detect prostatic growth. The acidic nature of the vagina means that it's somewhat inhospitable to sperm, and so prostatic secretions work with seminal vessel secretions to neutralise this environment. And this is one part of physiology that really amazes me. The fact that young males produce secretions to perfectly neutralise the environment of the vagina even before they ever see or come in contact with that region. It's an absolutely fascinating part of how the male and female reproductive systems work together to achieve fertilisation, even though they're present in two completely different bodies. The prostate is also quite muscular, and the prostate works with the regional sphincter muscles to help prevent semen from entering the bladder during ejaculation. They also help move secretions towards the urethra during erection, and the prostate also assists in preventing urine from entering the seminal ducts during urination. But why all the problems? Well, in most men's issues, it's because the prostate wraps around the urinary tube called the urethra. And there are two main reasons why this can induce symptoms. Firstly, as the prostate enlarges during aging, the increasing size of the organ is limited by how large it can grow outwards, and so simply compresses the urethra. Secondly, the muscular cells within the prostate can also grow, and if they contract, they then squeeze close the urethra. Both issues make it hard to urinate, and even then make it hard to fully empty the bladder when you can urinate. This results in the bladder becoming overactive, sometimes even resulting in incontinence. In particular, incomplete emptying or urinary retention increases the risk of infections, crystals forming, urinary stones. And it's drugs such as Flamaxtra or Flomax that you may have heard of that try to treat these muscular contractions compressing the urethra. Other options include surgery, in particular removing areas of the prostate surrounding the urethra, with the simple aim of opening up the tube and allowing release, along with other possible things to do. Prostate cancer. So the benign non-cancerous growth of the prostate occurs in nearly all males, particularly by the time they reach 80 years and above. The same phenomenon occurs in other animals, including primates and dogs, so this growth seems somewhat natural. The enlargement is most commonly associated with the conversion of testosterone into DHT. This DHT causes cell growth, inhibits cell death, and over time the prostate enlarges. Interestingly, the enzyme responsible for the conversion from testosterone to DHT is a target of such drugs like Propecia. The thing is, these rapidly dividing cells can also become cancerous. And it's sometimes tricky to tell the difference between normal prostatic enlargement and cancerous prostatic enlargement. It's also tricky to determine whether we should and how we should treat each of these diseases. However, positively, now that we know a lot more about the processes involved and the normal progressions of prostatic enlargement, we are getting better at detecting rapid, highly abnormal growth that could indicate cancer. Regular tests and assessment is the best thing you can do to care for your prostate, for early detection of any issues. Females, keep it on our radar. Remind us to get it checked. Talk about it. If you're a male and you're worried, see your doctor. We all have prostates, and for most of us, they will enlarge and cause some sort of issue, but it also means that it's a conversation your GP has had hundreds of times before, and we'll be happy to talk you through it and any other concerns. It's all part of looking after ourselves and keeping happy, healthy bodies.